once to another deeply human episode of Healthy Mind, Healthy Life. Welcome you all. I'm your host Avik, and today we are going to walk right into the heart of a topic that too often gets avoided, which is pain, mortality, and the tender courage it takes to live and die with dignity. So, dear listeners, let me ask you something. What does it mean to be a truly comfortable when you are facing something terminal? Or if I say, like, why is pain treated like a villain to silence instead of a voice to understand? And also, like, how can the medical system move from curing to caring, especially when the cure is no longer possible, right? So today's guest doesn't just answer these questions, he lives them. So please join me welcoming Dr. Steve Drabek. So welcome to the show, Dr. Steve.
Thank you very much, Avik.
Amazing. So
I'm
then,
happy to be here.
lovely, definitely. We are really, really happy to have you here today on our show. And so before we delve deep into the discussion, I'd love to introduce you with all the listeners. Dear listeners, Dr. Steve is also known as the Comfortologist, a board certified family physician, hospice, and palliative care expert, cancer survivor, and the author of the powerful memoir, The Comfortologist. So, with over 4 decades of service in family medicine and a personal journey through the uh, esophageal cancer and chronic pain, he brings a rare and raw blend of the clinical brilliance and soul deep compassion. So, he's here today not just to talk about the end of life care, but to challenge like how our culture treats chronic illness, pain, and death itself. So this isn't a sad story, it's a story about truth, love, and what it means to really show up for other, especially when it matters the most. So welcome to the show again.
Thank you. Uh, I appreciate that introduction.
Thank you so much. Yeah. So I'd love to ask you this, like, your medical career spans over 40 years, but it's your personal journey with cancer and the chronic pain that seems to have shifted your entire approach to care. So what changed inside you when you went from being the physician to becoming the patient?
It gave me a rare look at what it's like to earn your personal survival and well being to someone you absolutely do not know. Uh, I, I met the surgeon that operated on my cancer, and the following morning, he did the surgery. And a wonderful man at the Mayo Clinic. And it was just a great experience. I learned so many personal stories and adventures and it actually started just before my medical career began at the age of 30 years. So it was an eye opening, fearful time in my life, and also some very funny moments that occurred through that experience and just
Yeah.
made me think about what we ask people to do. And the old term, trust me, I'm a doctor, doesn't carry any weight.
Exactly. Understand. And like and how did that experience shape your work in palliative and end of life care going forward?
It made me much more interested in pursuing that.
Okay.
It was briefly mentioned in medical education in the early 1980s when I was a medical student,
Mhm.
and just in passing. And hospice is actually where I learned how to treat pain, and I developed chronic pain syndrome about 10 years after my cancer diagnosis,
Yeah.
uh, which was another uh, fearful time in my medical experience folder.
Okay.
I tried to bleed out, and it was in my stomach, which my stomach lies within my chest. So
Mm.
at that point, it was not an approachable organ surgically.
Mm.
And through the diligent work of an endoscopist who would not give up, he found the site of bleeding about 4 days after we began that adventure.
Yeah.
And I owe so many things to that position.
Got it. Mm.
And I worked with him and throughout my career as well.
Yeah. Lovely. I mean that's so powerful. I mean that's there's something humbling, like even sacred about a doctor who has walked through the fire and returned with deeper compassion. So, yeah, that's amazing.
You try to give people the information that they want
Ah.
and need. Uh, I was presented the diagnosis of cancer by the pathologist who did not have time to talk to me, but he made the comment, no, it was not dysplasia, which is a precancerous. It's adenocarcinoma. And I walked out of the hospital just dumbfounded. But at the same time, he was the one who ended up orchestrating my trip to the Mayo Clinic, which was the best place to go.
Uh-huh. Got
So I owe him a lot. And,
it. Mm-hmm.
the book is written on the premise of a book that I read about 20 years ago called When God Winks.
Mm-hmm.
It's about going through things and you think, why would God do this to me? But there's such a terrific lesson contained in all of our negative experiences throughout life.
Got it. So, okay, and we live in a society that often avoids the real conversations about pain, aging, death. I mean, as if pretending that they don't exist will uh, somehow make them less real, right? So, what do you think we are so uncomfortable with the mortality, and uh, how does that impact the way that we treat chronic illness and end of life care?
Well, medical education is all about doing whatever you can to avoid death.
Okay.
Um, that's just kind of drilled into our brains as students. And the concept of the doctor who says, "Well, if we don't, you'll die."
Hmm.
And the reality is, life is defined by a beginning and an end. And the best thing we can do as providers is make that experience as positive as possible. Hospitals are filled with people that are going through things that are worse than death. And it's
Hmm.
all about quality of life. And who
Exactly.
better to define the quality of life for me than me?
Mhm.
So there's a lot of things to take into consideration. And it involves conversation with patient, with family. And the medical community is such a hurry up and, have all the answers type of approach
Mhm.
to medical care. And, they used to refer to pneumonia as being the old man's friend.
Mhm.
It still is. And the thing that you can do to avoid pneumonia is to maintain physical activity. And there comes a point in life where you just can't do that. And if you don't breathe deep, you don't cough up the mucus and keep your lungs clear, that that brings pneumonia into the question and situation.
Mm.
And people that suffer from chronic pain, sometimes that's worse than death
Yeah.
because they're suffering continually. The medical community has been brainwashed to think the drug administration, the DEA, is out to get doctors.
Mm.
They're really not. They're out to make sure doctors follow the rules. And it's frustrating, but most of the medical avoidance of chronic pain is due to the lack of education in medical school about treating chronic pain. The education is all about new procedures, new surgical techniques, new this, new that, and it's all about avoiding death.
Yeah. Got it.
And when I would see people in the hospital, uh, they would look at me and say, "Well, nobody ever told me that I could say no."
Mm.
And it's an industry driven by the business community. Uh,
Mm.
and I understand that, and I've done very well, but still, it's about talking to the patient. What do you want? What
Yeah.
can we do? Now that with chronic pain, those people may not be near death, but some of them choose death either through suicide or
Mm.
whatever means. And early in my career, I had a partner who had a patient that had esophageal cancer who took his own life. And that really made me stop and think how fortunate I was. And that was within the first 6 months of my own surgical procedure, removing my esophagus. So it was it was a difficult thing to deal with, but fortunately, I dealt with it indirectly with my partner. And there's just some horrible things that if we would talk to people, and the older generation is used to thinking that doctors do have all the answers.
Yeah.
Every doctor should be at the bedside when a patient stops breathing. Those final moments, to me, they've been similar to a baby coming into the world.
Mm.
It's a wonderful moment, but I look at death in a different way because that's the end of their suffering. If it's physical, that's easy to see. If it's spiritual, that's more difficult. Emotional, fear, depression, those are real problems of people who are looking at the end of their life and what do they want to accomplish.
Exactly. Wow. And also like regarding your memoir, right? Uh, the Comfortologist is not just a book, so it's a mirror for anyone walking through pain or loss. So, what inspired you to write it? I mean, what do you hope readers, both the patients and the doctors, take away from it?
Well, I hope some of the doctors that I worked with uh, have read it. Some were actually mentioned, and I told them about it. One doctor that was mentioned, he did such a good job with people with emphysema at the end of life, and one of his patients who had lung cancer, he was
Mhm.
not going to allow that patient to go home where, where he wanted to go to be with his family, with his dogs. And I'm a dog person. I'll tell you up front, but he said, well, if your oxygen level gets above a certain amount, and he was on the maximum amount of oxygen that hospitals can give. And he was about 5 points below that. But we had an inpatient hospice, and his physician's assistant talked to me and said, "Would you all be able to take him over to the inpatient hospice unit?" I said, "Absolutely." And so we transferred him, and the next morning we transferred him home, or he wanted to be. We weren't perfect on his oxygenation, but he didn't care. He was ready. And he told me that. And so that had a positive impact on me, because I always tell people that Dorothy from The Wizard of Oz was absolutely correct. There's no place like home. And all the hospitalizations that I've had over the years have taught me it's a good place if there's a problem that can be addressed safely, effectively, and impact your quality of life. People with end stage cancer, more often it's pain, and doctors that treat cancer don't treat pain because they've been brainwashed to think if you treat pain with the appropriate narcotic pain relievers, you'll go to prison. And this all developed after the CDC guidelines in 2016, but the first paragraph specifically says this is not intended to impact palliative care or active cancer treatment. What I've found is they don't understand pain well enough, and every computerized record now puts out prescriptions that says as needed for pain. So we can't take chronic pain away. We can manage it. We can't eliminate it. And so many people think, oh, I can take an extra pill because that's what it says. So in a sense, it tells them they can take as much as they want if they're hurting. So it's a different way to address the pain. That's such an important concept. You take it by the claw. You don't wait till the pain gets big. The old story of the tortoise and the hare always applies. That darn turtle wins every time because he stopped, or because the rabbit stops, and the tortoise just
Mm.
goes along consistently. And that was one of my favorite things because chronic pain patients, I would tell them that, and they'd come back sometimes a few weeks later. I had one lady that was in her 80s. It's like 2 years after she started seeing me. She said, "You know, Dr. Drabek, I finally started doing what you said to do." I said, "Well, what's that?" She said, "Taking the pain by the clock." And I would always look at them with a smile and say, "I told you so." And we would laugh about it because I understand that so well, having had chronic pain for 28 years myself. And you function better with pain control. And if you take extra doses, you run out early, you can't get them filled, you create crises. But it, it's such a wonderful experience. For me, it was treating chronic pain. And then when I got sick with COVID and had to retire, I still suffer a little bit of guilt. I still talk to some of my patients because they're told things that are not true by other doctors who don't understand chronic pain.
Exactly. Yeah. Lovely. Lovely. And I mean, any one message you want to share with the listeners today?
Um, the patient is our, I mean, if it's my patient, it's their life.
Yeah.
In the state of Oklahoma, we don't have a death with dignity law,
Yeah.
which is unfortunate. There's more and more states every year in the United States And at least they quit calling it physician assisted suicide because these are terminally ill patients and it can be such a peaceful experience. But to relieve their pain, I carry a picture with me about a I think he was in his early 60s, the guy who did not want to be in the hospital. We got him home, and his sister sent me a picture on my cell phone about a week later of her brother because all he wanted to do was take his grandchildren fishing. And that picture is of him and his grandchildren on a pier on a lake fishing. And that means a lot to me as a fisherman as well. But just those are good memories. And,
Okay.
you know, if some of the emergency room doctors would call me down to the emergency room, and one day they said, "Oh, look, it's Dr. Beth." And I was somewhat in a mood that day. And I said, "Look, I'm Dr. Pleasant Death." And I would have to cancel the orders that they wrote for a patient who flat out said, "I do not want blood. I do not want antibiotic." And all those things were started by the emergency room physicians. So I just, that my book is full of experiences that are unexplainable as well. Uh, People that I'm proud I was involved with their end of life care. And an interesting fact, we in the inpatient unit we allowed pets, as long as their immunizations were up to date and they weren't vicious. But about half the people that were reluctant to go to the inpatient hospice unit, they wanted to go home. And about 50% of the people that were reluctant to go to the inpatient unit changed their mind when I told them pets were allowed. And some of the most incredible pets were there. And I took my own dog, and he would walk into the room, and the whole mood changed. And making home visits, I only got bit one time. It was by a small dog, but you understand that they're protecting their master. And you never get between the dog and the master because I'd always sit on the bed or the couch to talk to the patient and the family. So just a lot of absolutely wonderful experiences that I just wanted to write about.
Mm, that's amazing. Yeah. Lovely. Great, great. So, dear listeners, this episode wasn't just about the death, it's all about how we live and how we show up for ourselves and each other, especially when things get hard. And if you or a loved one is walking through the chronic illness, grief, or uncertainty right now, let this episode be your reminder that you are not alone, you are not a burden, and you are a worthy of comfort, not just survival. So go pick up,
Absolutely.
yeah, go pick up the Comfortologist, follow Dr. Drabek's walk, and more than anything, don't be afraid to speak your truth, especially when it hurts, because that's where real healing begins. So,
Absolutely.
with this hope, dear listeners, until next time, take care of your heart, take care of your each other, and remember the most powerful medicine might just be the one that we carry within. So, this is
And the
Avik.
book is available at Barnes and Noble and Whitestone.
Yeah, perfect. And dear listeners, I'll put all the links into the show notes for your easy reference. And with this hope, until next time, this is Avik signing off from Healthy Mind, Healthy Life. Stay present, stay kind, and stay human. So, thank you so much.